Welcome. Ever feel like your eyelids are itchy, gritty, or just plain irritated? You might be experiencing blepharitis. In this video, we'll explore everything you need to know about this common eye condition, from its causes and symptoms to treatment and prevention. So, let's dive in and shed some light on blepharitis. Blepharitis isn't caused by one single thing. It's often a combination of factors that disrupt the normal environment of your eyelids. The most common culprits include bacterial infection, often involving Staphylococcus bacteria that naturally live on our skin. Another common factor is meibomian gland dysfunction, or MGD. These tiny glands in your eyelids produce oil that helps keep your eyes moist. When they become blocked or inflamed, it can lead to blepharitis. Other contributing factors may include dandruff of the scalp and eyebrows, seborrheic dermatitis, allergies, and even Demodex mites, tiny microscopic mites that live in hair follicles. Okay, let's talk about what's actually happening on a cellular level. Essentially, blepharitis involves inflammation of the eyelids. When bacteria or other irritants are present, they trigger an immune response. This response leads to redness, swelling, and the characteristic crusting and scaling along the eyelid margins. In meibomian gland dysfunction, the blocked oil glands prevent the normal flow of oil into the tear film. This disrupted tear film evaporates too quickly, leading to dry eye symptoms and further irritation, contributing to the inflammatory cycle. Blepharitis is incredibly common. It affects people of all ages and backgrounds, but it's more prevalent in older adults. Studies estimate that a significant percentage of the population experiences blepharitis at some point in their lives. While exact numbers vary, it's safe to say that blepharitis is a widespread issue, making it important to understand and manage the condition effectively. Now, let's discuss the telltale signs. Blepharitis can manifest in a variety of ways. You might experience itchy burning or stinging eyes. Your eyelids may be red, swollen, and crusty, especially upon waking. You might feel like there's something gritty in your eye, even when there isn't. Other symptoms include excessive tearing, sensitivity to light, and even blurred vision that often improves with blinking. Some people also experience loss of eyelashes or misdirection of eyelash growth. Diagnosing blepharitis typically involves a comprehensive eye exam by an optometrist or ophthalmologist. They'll carefully examine your eyelids and eyelashes, looking for signs of inflammation, crusting, and blocked oil glands. The doctor might also ask about your medical history and symptoms. In some cases, they may take a swab of the eyelid margin to test for bacteria or other organisms. The diagnosis is primarily clinical, based on the appearance of the eyelids and the reported symptoms. Blepharitis can be broadly categorized into two main types: anterior blepharitis and posterior blepharitis. Anterior blepharitis primarily affects the outside front edge of the eyelid, where the eyelashes are attached. It's often caused by bacteria or dandruff. Posterior blepharitis, on the other hand, affects the inner edge of the eyelid, where it meets the eye. This is usually associated with meibomian gland dysfunction, leading to oily debris and inflammation along the eyelid margin. Some individuals may experience a combination of both anterior and posterior blepharitis. While there's no cure for blepharitis, it can be effectively managed with proper hygiene and treatment. The cornerstone of treatment is warm compresses applied to the eyelids for 5–10 minutes at a time, several times a day. This helps to loosen crusts and melt block oil secretions. Following warm compresses, gently scrub the eyelids with a diluted baby shampoo or a commercially available eyelid cleanser. If bacterial infection is suspected, your doctor may prescribe antibiotic eye drops or ointment. In cases of severe inflammation, topical corticosteroids might be used, but only under the guidance of a doctor. Artificial tears can also help alleviate dry eye symptoms. Omega-3 fatty acid supplements may improve meibomian gland function. Preventing blepharitis involves maintaining good eyelid hygiene. Regularly cleanse your eyelids, even if you're not experiencing symptoms. Avoid rubbing your eyes, as this can introduce bacteria and irritants. If you have dandruff, use a medicated shampoo to control it. Consider using a humidifier to add moisture to the air, especially during dry months. And if you wear contact lenses, make sure to follow proper cleaning and disinfection procedures to prevent infection. The prognosis for blepharitis is generally good with consistent management. While symptoms may recur, they can usually be controlled with ongoing eyelid hygiene and treatment. Recent research focuses on improving treatments for meibomian gland dysfunction, including advanced thermal pulsation devices and intense pulsed light therapy. These technologies aim to unclog and stimulate the meibomian glands, improving tear film stability and reducing inflammation. Researchers are also exploring new topical medications and therapies to target the underlying causes of blepharitis and provide more effective long-term relief. Stay tuned for further advancements in the treatment and management of this common eye condition.